A compassionate nurse risks her career to help a struggling patient, only to uncover a hospital built on corruption and greed. Her journey to expose the truth pits her against powerful forces, but her courage sparks a revolution in patient care. Witness the story of resilience, justice, and the fight for humanity in the face of systemic betrayal. In the heart of the bustling city stood Crestview General Hospital, a sprawling institution known more for its pristine halls and towering profits than for the warmth of its care. Doctors and nurses moved with purpose, their steps brisk, their faces impassive. Among them was Claire Bennett, a nurse who stood apart, not because of her crisp uniform or her flawless technique, but because of her heart. Claire wasn't like the others. While most of her colleagues focused on efficiency and protocol, Claire noticed the details that others overlooked. A trembling hand clutching a worn-out blanket, the quiet tears of a frightened child, or the hushed whispers of families praying for miracles. It was these small moments that fueled her passion, reminding her of why she chose nursing in the first place. On a cold Wednesday evening, as the winter winds howled outside, Claire found herself on the night shift. The hospital buzzed with its usual chaos, emergency alarms, intercom announcements, and hurried footsteps echoing through the halls. Claire, though weary, moved from room to room, offering a kind word here, a gentle touch there. It was during one of these rounds that she encountered Mr. Daniels, a frail, elderly man seated in the corner of the waiting room. His clothes were worn, his hands calloused, and his face etched with lines that spoke of a life filled with hardship. He sat hunched over, clutching a crumpled prescription slip in one hand and a near-empty wallet in the other. Claire approached him with her signature warmth. "Mr. Daniels," she said softly, "you've been sitting here a while. Is everything all right?" The man looked up, his eyes filled with a mixture of embarrassment and despair. I need this medicine," he stammered, holding up the slip, "but I can't afford it. I thought maybe they'd let me pay later." Claire's heart ached at his words. She knew the hospital's policies well, strict, unyielding, and merciless toward those who couldn't pay. Patients like Mr. Daniels often fell through the cracks, their pleas drowned out by the cold machinery of bureaucracy. Against her better judgment, Claire made a decision. "Wait here," she said gently. Walking swiftly to the pharmacy counter, she handed over her own credit card to cover the cost of the medication. It wasn't the first time she had done something like this, and it likely wouldn't be the last. Claire returned with the medicine, placing it in Mr. Daniels's trembling hands. "I can't thank you enough," he whispered, tears glistening in his eyes. "You've saved my life." Claire smiled, brushing off his gratitude. "Just take care of yourself, Mr. Daniels," she replied, her tone light but her heart heavy with the knowledge that her actions, though small, could have serious consequences. Unbeknownst to Claire, her kindness hadn't gone unnoticed. A junior nurse had seen the transaction and, bound by the rigid rules of the hospital, reported it to Ms. Greer, the hospital's administrator. Greer was a woman of precision and order, her loyalty tied not to the patients but to the bottom line. To her, Claire's actions weren't compassionate, they were insubordinate. As Claire finished her shift that night, she felt a strange unease settle over her. She had no way of knowing that this single act of kindness would ignite a chain of events that would forever alter her life, and the very foundation of Crestview General Hospital. Claire Bennett wasn't born into wealth or privilege. Raised by a single mother in a small, close-knit community, her childhood was defined by resilience and sacrifice. Her mother, Mary, worked 2 jobs, cleaning houses during the day and working at a diner at night, to ensure Claire had the basics. Yet, even with Mary's tireless efforts, money was always tight. Claire's earliest memory of a hospital wasn't a happy one. She was 6 years old, clutching her mother's hand as they sat in an emergency room waiting area. Her mother had injured her wrist cleaning a client's attic, but without insurance, they were made to wait for hours. Claire remembered the pitying looks from the staff, the whispers about unpaid bills, and the way her mother's cheeks flushed with humiliation. That night, as her mother cradled her injured hand and tucked Claire into bed, she whispered something Claire would never forget. "Never let anyone feel like they don't matter, no matter where they come from." Those words became a mantra, shaping Claire's life and her eventual career. Years later, Claire worked her way through nursing school, balancing part-time jobs and sleepless nights. While many of her classmates dreamed of working in prestigious hospitals or private practices, Claire's goal was simple: to help those who were often overlooked, the struggling, the vulnerable, the ones who couldn't advocate for themselves. When she landed a job at Crestview General Hospital, Claire believed she had found her calling. The hospital was renowned for its cutting-edge technology and high-profile clientele, but it also served the city's lower-income neighborhoods. To Claire, this was the perfect balance, a chance to make a difference while honing her skills. But it didn't take long for Claire to notice the cracks in the system. Patients without insurance were treated like burdens, rushed through their appointments, or denied care altogether. The administration prioritized profits over people, and staff were discouraged from going above and beyond. Still, Claire held on to her mother's words, finding small ways to defy the system. She would slip extra food to patients who couldn't afford the cafeteria prices, or spend an extra 5 minutes comforting a frightened child. To her, these acts weren't grand gestures. They were simply the right thing to do. Her compassion didn't go unnoticed. Patients adored her, often requesting her by name. "You remind me of my granddaughter," an elderly woman once told her, squeezing Claire's hand with frail fingers. "The world needs more people like you." Claire cherished these moments, but she knew her approach wasn't always appreciated by her colleagues or the administration. Ms. Greer, the hospital's stern and calculating administrator, had warned Claire more than once about bending the rules. "We're running a business, not a charity," Greer had said during one particularly tense meeting. Claire had nodded politely, biting back her retort. She knew that challenging Greer's authority could jeopardize her job, but she couldn't bring herself to stop caring. As Claire's reputation for kindness grew, so did the tension between her and the administration. She began to feel like a lone soldier in a battle against an unfeeling machine. Yet, despite the challenges, she never wavered in her commitment to her patients. What Claire didn't realize was that her dedication would soon place her directly in the crosshairs of that unfeeling machine. And as she went about her daily duties, unaware of the storm brewing above her, she had no idea that her life was about to take a dramatic turn. It was a quiet afternoon at Crestview General Hospital, the kind of day where the usual chaos seemed momentarily subdued. Claire was making her rounds, checking on patients and ensuring that everything was in order. Her mind was preoccupied with the memory of Mr. Daniels and the small act of kindness she had extended to him just days earlier. She wondered if he was recovering well, though she hadn't seen him since that night. As she walked past the reception desk, she noticed a commotion. Ms. Greer, the hospital administrator, stood with her arms crossed, her stern expression fixed on a junior nurse. The young woman, visibly nervous, clutched a clipboard and avoided eye contact. "Claire Bennett." Ms. Greer's voice sliced through the air, freezing Claire mid-step. "My office. Now." Claire's heart sank as she followed Ms. Greer down the pristine, echoing hallways. The administrator's office was an intimidating space, large, cold, and lined with filing cabinets that seemed to hold the secrets of every employee who had ever crossed her path. Claire sat stiffly as Ms. Greer closed the door behind them. "I've received a report," Ms. Greer began, her voice sharp and unyielding. "It seems you've been engaging in activities that directly violate hospital policy." Claire's pulse quickened. "What activities are you referring to?" she asked, though she already had an idea. "Helping patients pay for their treatments out of your own pocket," Ms. Greer said, her tone dripping with disdain. "You know that is strictly against our guidelines. This is a business, not a charity." Claire took a deep breath, willing herself to stay calm. Mr. Daniels was in desperate need. "I couldn't just stand by and do nothing." Ms. Greer's eyes narrowed. "Your compassion is noted, but it's misplaced. We have rules for a reason, and by breaking them, you've put this hospital at risk. Effective immediately, you are suspended without pay pending further investigation." Claire felt like the floor had been pulled out from under her. "Suspended?" she repeated, disbelief evident in her voice. "All I did was help someone in need. Isn't that why we're here? To care for people?" Ms. Greer's expression hardened. "We're here to provide care within the parameters of our policies. You've left me no choice." As Claire left the office, her mind raced. The reality of her suspension hit her like a wave. But what stung even more was the implication that her compassion had been a mistake. Walking through the hospital one last time, she caught glimpses of the patients she had cared for. The young mother with a sick child, the elderly man recovering from surgery, the faces she had come to know and care about deeply. That evening, Claire sat at her small kitchen table, her head in her hands. The weight of the day pressed heavily on her shoulders. She had always believed that her work mattered, that her kindness could make a difference. But now, she was left questioning everything. Had she been wrong to defy the rules? Was there even a place for someone like her in a system that seemed to value profits over people? Before she could sink too deeply into her thoughts, there was a knock at her door. Opening it, she found Mr. Daniels standing there, his frail frame bundled against the cold. He held a small, neatly wrapped package in his hands. "I heard what happened," he said softly, "and I wanted to thank you. What you did for me, it saved my life." Claire's eyes filled with tears as she invited him inside. They sat together, and Mr. Daniels shared stories of his life. A life marked by struggles, but also by resilience. His gratitude reminded Claire of why she had become a nurse in the first place. As Mr. Daniels left that evening, he turned back and said something that stayed with Claire long after the door closed behind him. "Sometimes, the world needs people like you to shake things up. Don't stop being who you are, no matter what." It was a small spark of hope, but it was enough. Claire realized that her fight wasn't over. The system might be flawed, but she wasn't powerless. And as she resolved to uncover the deeper issues plaguing Crestview General Hospital, she had no idea just how much her journey would uncover. Not just about the hospital, but about herself. The days following her suspension were some of the darkest Claire had ever experienced. Without the structure and purpose of her daily routine, she felt adrift. The small apartment that once felt like her sanctuary now seemed suffocating. Bills began to pile up, and the whispers of doubt in her mind grew louder. Had she truly made a difference, or had she simply been reckless? Claire spent her mornings combing through job listings, only to face rejection after rejection. News of her suspension had spread, and the healthcare community was hesitant to hire someone who had violated protocol. By afternoon, she would sit by the window, staring out at the city she had once felt so connected to, wondering if she had lost her way. One day, as she sorted through a stack of unopened mail, Claire came across an envelope with no return address. The handwriting on the front was unfamiliar, but the contents were even more surprising. Inside was a single sheet of paper with a typed note. "If you think you've seen injustice, you're only scratching the surface. Check the hospital's quarterly reports, especially the sections they don't share with the public." There was no signature, no indication of who had sent it. At first, Claire dismissed it as a cruel joke. But as the hours passed, curiosity gnawed at her. The message hinted at something bigger, something she couldn't ignore. The next morning, Claire found herself at the local library. The hospital's publicly available financial reports were dense and filled with jargon, but Claire combed through them with determination. It wasn't long before patterns began to emerge. The hospital had reported consistent financial growth, but certain line items didn't add up. Expenses were marked as miscellaneous in unusually large amounts, and donations from anonymous sources far exceeded the hospital's actual reported charitable efforts. As Claire dug deeper, she uncovered a troubling trend. Patients with insurance were being overbilled, while those without it were often denied care altogether, regardless of their critical needs. Worse, there were records of unnecessary procedures being recommended, procedures that brought in significant revenue but were medically unwarranted. Claire's heart sank as she realized the scale of the corruption. This wasn't just about her suspension or a single act of kindness. It was about an entire system built on exploiting the vulnerable. She thought about the patients she had cared for, the ones who had trusted the hospital with their lives, and felt a surge of anger. How many of them had suffered because of these practices? How many had been turned away, ignored, or pushed into financial ruin? Her investigation didn't stop there. Over the following weeks, Claire began reaching out to former colleagues. Many were hesitant to talk, fearful of retaliation, but a few shared troubling stories. One nurse recounted how she had been pressured to discharge a critically ill patient because they lacked insurance. A doctor admitted that he had been instructed to recommend expensive tests to meet revenue targets. Then came the most shocking revelation. An anonymous source, claiming to be a former hospital accountant, sent Claire a flash drive containing internal emails and documents. The files revealed a scheme where the administration, led by Ms. Greer, had been siphoning funds meant for charitable care into private accounts. The evidence was damning. But as Claire pored over the documents late one night, a new fear crept in. She was just one person. What could she possibly do against an institution as powerful as Crestview General Hospital? And what would happen if they discovered her investigation? The answer came in an unexpected form. A knock at her door startled her from her thoughts. Opening it, she found Dr. Hayes, a junior doctor from the hospital who had always been kind but reserved. He held a folder and wore an expression that was both serious and determined. "I heard what happened," he said, "and I've seen enough to know you're right. The hospital is corrupt, and it's hurting people. I want to help." Claire's relief was palpable. For the first time, she didn't feel alone. Together, they spent hours piecing together the evidence, compiling a report that they hoped would expose the hospital's practices. But with each new discovery, the weight of their task grew heavier. They weren't just uncovering financial misconduct, they were challenging a system that thrived on fear and silence. As the weeks turned into months, Claire and Dr. Hayes worked tirelessly, meeting in secret and reaching out to journalists, lawyers, and patient advocacy groups. Every step forward felt like a small victory, but the risk loomed large. Threatening phone calls began to disrupt Claire's evenings, and one day, she noticed a car parked outside her apartment that seemed to linger too long. Despite the intimidation, Claire's resolve only strengthened. She thought of Mr. Daniels and the countless others who had been mistreated. They deserved justice. And though the journey ahead was uncertain, Claire knew one thing for sure. She wouldn't back down. As Claire and Dr. Hayes pressed forward with their investigation, their determination began to attract attention. It started with whispers among former hospital employees, nurses, janitors, even a few administrative staff, each carrying their own stories of questionable practices and unspoken rules. Slowly but surely, these whispers turned into support. One by one, they came forward. A veteran nurse, who had been forced into early retirement after questioning the hospital's billing practices, provided documents she had kept in secret for years. A janitor shared details about overheard conversations in closed-door meetings, hinting at cover-ups and misconduct. Even a current administrative assistant anonymously passed along emails that revealed the depth of the corruption. Dr. Hayes became an invaluable ally, using his position within the hospital to gather critical evidence. He began discreetly questioning other doctors, many of whom shared similar frustrations but feared retaliation. The truth is, one senior physician admitted, "We've all known something was wrong, but standing up to them, it feels impossible." But Claire wasn't just looking for allies within the hospital. She reached out to patient advocacy groups, explaining the injustices she had witnessed and the evidence she was uncovering. To her surprise, many of these organizations were eager to help. They had long suspected that hospitals like Crestview were exploiting vulnerable patients, but Claire's first-hand accounts and evidence gave their suspicions weight. With each new ally, Claire's confidence grew. Together, they began crafting a detailed exposé, a report that laid bare the hospital's unethical practices, from overbilling to outright fraud. The report wasn't just about numbers. It included stories of real people who had suffered under the hospital's policies. Each story was a testament to the human cost of corruption. Yet, for every step forward, there were setbacks. One evening, as Claire and Dr. Hayes reviewed their growing pile of evidence, Claire received a chilling email. "Drop this now, or you'll regret it." Attached was a photo of her apartment building, taken just hours earlier. Dr. Hayes looked up from the screen, his face pale but resolute. "We're doing the right thing, Claire," he said firmly. "Don't let them scare you." The intimidation didn't stop there. A local tabloid published an article smearing Claire's reputation, accusing her of stealing from patients and fabricating her claims. Though the accusations were baseless, they stung deeply. "They're trying to discredit me before we can even go public," Claire said, her voice trembling. But Dr. Hayes reminded her that such tactics only proved how desperate the hospital had become. Determined to fight back, Claire and her growing network of allies took their story to the local press. A prominent investigative journalist agreed to meet with them, intrigued by the depth of their evidence. Over the course of several interviews, Claire shared everything: her suspension, the documents, the stories of patients who had suffered. The journalist, a seasoned professional, promised to bring their findings to light. Meanwhile, Claire began reaching out to the patients she had cared for, including Mr. Daniels. His story, along with those of others, became the emotional core of their campaign. The people need to see the faces behind these numbers, Claire explained during a meeting with the advocacy groups. It's not just about financial fraud. It's about lives that were shattered. The support continued to grow. Former employees and patients started sharing their stories on social media, creating a ripple effect that brought even more attention to the issue. Within weeks, the hashtag Justice for Patients began trending, amplifying their cause far beyond the city. But the most significant breakthrough came when a whistleblower, an accountant who had recently resigned from the hospital, reached out to Claire. "I've seen the books," the whistleblower said during their first meeting. "What they're doing isn't just unethical, it's illegal." The whistleblower provided detailed financial records, proving that hospital executives had been funneling money into offshore accounts while denying care to patients in need. This revelation became the cornerstone of Claire's exposé, transforming their case from a local scandal to a potential national story. As the report neared completion, Claire couldn't help but feel a mix of hope and fear. She knew they were on the verge of something monumental, but the stakes had never been higher. One evening, as she sat with Dr. Hayes reviewing the final draft of their exposé, he turned to her and said, "You've started something incredible here, Claire. No matter what happens next, you've already made a difference." Claire nodded, feeling a renewed sense of purpose. She wasn't just fighting for justice. She was fighting for every patient who had been silenced, every nurse who had been forced to turn a blind eye, and every doctor who had felt powerless against the system. And as the final pieces of their plan fell into place, she knew there was no turning back. The day of the exposé's release dawned cold and overcast, but for Claire, it felt like a storm had already broken. The investigative journalist had promised to publish the story in a major outlet, complete with interviews, evidence, and testimonials. As Claire sat in her small living room, surrounded by stacks of documents and notes, she felt the weight of what was about to happen. By noon, the article went live, titled, "Crestview General, Profits Over Patients, a Scandal Exposed." Within minutes, it began circulating widely, shared across social media, and picked up by local news stations. Claire's phone buzzed nonstop with messages from former colleagues, patients, and advocacy groups, all expressing shock and outrage at the revelations. At the hospital, chaos erupted. Ms. Greer stormed into an emergency board meeting, her face pale and drawn. Executives scrambled to contain the damage, but the evidence was too overwhelming. The whistleblower's financial records, paired with Claire's first-hand accounts and patient testimonials, painted a damning picture of systemic corruption. By mid-afternoon, protesters had gathered outside the hospital, holding signs that read "Healthcare, Not Profits" and "Justice for Patients." Reporters swarmed the building, demanding answers from hospital leadership. Claire watched the live coverage from her apartment, her emotions a mix of relief and apprehension. That evening, a press conference was hastily organized by the hospital's board. Ms. Greer, flanked by legal advisors, attempted to downplay the allegations. "These claims are exaggerated and do not reflect the values of Crestview General," she said, her tone clipped. But before the conference could conclude, an unexpected voice interrupted. Dr. Hayes stepped forward, his face calm but resolute. "I'm here to confirm that everything in the report is true," he said, addressing the crowd of journalists. "As a doctor at this hospital, I've witnessed firsthand the unethical practices outlined in the article. Patients have been denied care, overcharged, and mistreated, all in the name of profit." The room erupted with questions, cameras flashing as Dr. Hayes continued. "It's time for change, not just at Crestview, but in healthcare as a whole. We owe it to our patients to do better." Dr. Hayes's public statement was a turning point. Within hours, the hospital's board announced Ms. Greer's resignation, along with an internal investigation into the practices revealed in the exposé. But for Claire, the fight was far from over. She knew that accountability wasn't enough. There needed to be lasting reform. With the support of advocacy groups and patient testimonies, Claire filed a formal complaint with the State Medical Board and the Attorney General's office. The whistleblower's evidence became the backbone of the case, leading to a criminal investigation into Crestview financial misconduct. Amid the turmoil, Claire received a surprising invitation to appear on a nationally televised news program. Seated across from the anchor under the bright studio lights, she recounted her journey, from helping Mr. Daniels to uncovering the hospital's secrets. "Why did you risk everything?" the anchor asked, her tone curious but respectful. Claire paused, her voice steady but filled with emotion. "Because it was the right thing to do. Patients deserve to be treated with dignity and care, not seen as dollar signs. And because someone had to speak up. If I didn't, who would?" Her words resonated deeply, sparking a broader conversation about ethics and healthcare. Advocacy groups across the country began using Claire's story as a rallying cry, pushing for reforms to protect patients and hold institutions accountable. Back in her apartment, Claire sat with Dr. Hayes and Mr. Daniels, who had become one of her staunchest supporters. Together, they watched the news coverage of Crestview's downfall and the growing calls for justice. Mr. Daniels, his voice filled with quiet pride, said, "You didn't just change the hospital, Claire. You changed lives." Claire smiled, though her eyes glistened with tears. "We all did," she replied. "This was never about just one person. It was about standing up for what's right, no matter the cost." The following week, the state announced sweeping reforms for hospitals across the region, inspired by Claire's case. Crestview General was placed under new leadership with a renewed commitment to patient care. And though the fight had been long and grueling, Claire felt a sense of peace knowing that her efforts had made a difference. Months passed, and life began to settle into a new rhythm for Claire. The fallout from the expose had been massive. Multiple hospital executives were under investigation, and the healthcare system as a whole faced mounting pressure to enact meaningful reforms. But for Claire, the greatest reward wasn't the headlines or the accolades. It was the quiet knowledge that her actions had sparked change. Sitting by her apartment window one sunny afternoon, Claire watched as the city bustled below. Her phone buzzed with a message from Dr. Hayes. "Patient Advocacy Summit tomorrow. They'd like you to speak." Claire smiled, reflecting on how much her life had transformed. Though her path as a nurse had been disrupted, she had found a new purpose as an advocate for ethical care. The next day, Claire stood in front of a packed auditorium. Her voice, steady and filled with conviction, carried through the room as she shared her story. "When I started this journey, I was just a nurse doing what I thought was right," she said. "I didn't plan to take on a system or to uncover corruption. But when you see injustice, you have a choice, to ignore it or to fight it." Her words were met with thunderous applause. Among the audience were nurses, doctors, and patients, all inspired by her courage. Claire felt a wave of gratitude wash over her. She wasn't alone in this fight, and together, they could build a future where care and compassion weren't just ideals but realities. Back in the city, Crestview General Hospital underwent a transformation. With a new administration in place, the focus shifted back to patient care. Free clinics were established for low-income communities, and policies were rewritten to prioritize dignity and access. Claire often visited the hospital, now as an advisor rather than a staff member, and felt a sense of pride seeing the change she had helped bring about. Mr. Daniels remained a steadfast presence in her life. One evening, over a simple dinner at her apartment, he handed her a small, weathered notebook. "What's this?" Claire asked, flipping through its pages. "It's my story," Mr. Daniels replied. "You told me that every voice matters, so I wrote mine down. Maybe one day, someone will read it and feel less alone." Claire was deeply moved. "Your story does matter," she said, gripping his hand. "And it's voices like yours that remind us why this fight is so important." As time went on, Claire continued to advocate for change, her efforts expanding beyond Crestview to other hospitals and institutions. Her network of allies grew, and she became a trusted figure in the fight for healthcare reform. Yet, despite her growing influence, she remained grounded in the values her mother had instilled in her: kindness, integrity, and the belief that every person deserved to be treated with dignity. One quiet evening, Claire visited her mother's grave, a bouquet of fresh flowers in hand. Standing there, she spoke softly. "You always told me to never let anyone feel like they don't matter. I hope I've made you proud, Mom." The wind rustled gently through the trees, and Claire felt a profound sense of peace. Her journey hadn't been easy, but it had been worth every sacrifice. In the years that followed, Claire's story became a beacon of hope. Her actions inspired countless others to speak up against injustice, to stand firm in the face of adversity, and to believe in the power of one person to make a difference. And though Claire never sought recognition, she found fulfillment in knowing that her fight had created a ripple effect, one that would continue to grow, touching lives far beyond her own. Sitting by her window on another quiet evening, Claire gazed at the city skyline. In the distance, the lights of Crestview General Hospital twinkled, a reminder of the journey she had taken and the change she had ignited. With a deep breath, she turned back to her desk, where another patient advocacy report awaited her attention. For Claire, the work was never truly done, but she welcomed it, knowing that every step forward was a step toward a world where compassion and care were not exceptions but the rule.